Welcome to aminacademy.com. In questions, how, why, and what. In that, let us answer these questions. Who was Sushruta? Who is the father of surgery? And what is yoga? Sushruta is the father of surgery. If the history of science is traced back to its origin, it probably starts from an unmarked era of ancient time. Although the science of medicine and surgery has advanced by leaps and bounds today, many techniques practiced today have still been derived from the practice of the ancient Indian scholars. All the basic principles of surgery, such as planning, precision, hemostasis, and perfection, find important places in Susruta's writing on the subject. He has described various reconstructive procedures for different types of defects. His works are compiled as Susruta's Samhita. He describes 60 types of upkarma for treatment of wound, 120 surgical instruments, and 300 surgical procedures, and classification of human surgeries in 8 categories. He treated numerous cases of Nasa Sandan, Osta Sandan, like different types of diseases he treated. Now, let us discuss further about the answers of these questions. Sushruta is known as the father of surgery and is considered a pioneer of ancient Indian medicine. He lived in the ancient city of Kashi, India, sometimes between 1000 and 800 BC. Surgical techniques. Sushruta's techniques included nasal reconstruction, earlobe repair, lip repair, and skin grafting. He used instruments he crafted himself, his techniques were ahead of their time. Emphasis on cleanliness and anesthesia. Sushruta used herbal anesthetic and emphasized postoperative care. Documentation. Sushruta's detailed documentation of his surgical techniques and instruments laid the foundation for modern surgical education. Influence on other fields. Sushruta work influenced the development of reconstructive surgery, orthopedics, and ophthalmology. Legacy. Sustrata's teaching and innovations continue to shape modern surgical practices. Legacy in the Association of Plastic Surgeons of India. The Association of Plastic Surgeons of India includes Sushruta in its emblem to honor his life and work. Legacy in the Sushruta's Samhita, and Sushruta Samhita is a compendium that documents Sushruta's theories about medicine. It includes description of medic, mediclinic herbs and herbal minerals formulation. Now further about his life. Like scientific medicines, Ayurveda has both preventive and curative aspects. That is called Ayurveda medicine. The preventive component emphasizes the need for a strict code of personal and social hygiene, the detail of which depends upon individual climatic and environmental needs. Bodily exercise, the use of herbal preparations, and yoga form a part of the remedial measures. The curative aspects of Ayurveda involves the use of herbal medicines, external preparations, physiotherapy, and diet. It is a principle of Ayurveda that the preventive and therapeutic measures to be adapted to the personal requirement of each patient. Further about Ayurveda, the golden age of Indian medicine from 800 BCE until about 1000 CE was marked especially by the production of the medical treatise known as the Karaka Samhita and Sushruta Samhita, attributed respectively to Karaka, a physician, and Sushruta, a surgeon. Estimates place the Karaka Samhita in its present form of the dating from 1st century CE. Along there were earlier version, the Sushruta Samhita, probably originated in the last centuries BCE and had become fixed in its present form by the 7th century CE. Of somewhat lesser importance are the treatises attributed to Bhagavata. All later writings in Indian medicines were based on these works, which analyzes the human body in terms of earth, water, fire, air, and either ether, as well as the three bodily humus, Vata, Pitta, and Kapha. Now we talk about little about what is yoga. Yoga is an ancient Indian practice that combines the body, breath, and mind to promote physical and mental well being. Origin. Yoga originated as a spiritual practice thousands of years ago with its root in the Upanishad, a collection of yogic texts. The word yoga comes from the Sanskrit root, which means to join, to unite. Practice. Yoga involves a variety of poses, asanas, breathing techniques, pranayama, and meditation, dhyana. Yoga sessions typically starts with gentle poses and progress to more challenging ones. Yoga can help with stress, anxiety, depression, chronic pain, and sleep. It can also improve flexibility, muscles, strength, and heart health. Popularity. In the West, yoga is often practiced as a form of exercise or to reduce stresses. There are many different styles of yoga, from gentle to physically demanding. Safety. Many types of yoga are safe when guided by a well trained instructor. However, it is advisable to consult a medical professional before starting yoga practice. So far, we discussed about was who is the father of surgery and what is Ayurveda and what is yoga. We have done. Please subscribe our YouTube channel.